Hey, friends and listeners of the Switch for Good podcast. Yep, that's you. I have some really exciting news. Dotsie and I have started a Switch for Good podcast Facebook group. We created it so we can build a community of fans that will help us improve the show and deliver on the topics that you want to learn more about. So we want to hear what your favorite content is, what you want more of, and what you want less of. And if you like the length of the show, Dotsie and I are always talking about the length of the show, right, Dotsie?
Yes.
We want to tailor our show around the needs and desires of our incredible listeners, almost 500,000 of you. And it's really simple to join. Just go to our Switch for Good Facebook page. That's Switch, the number 4, and then Good. And then click on groups. And there we are, the Switch for Good podcast chat. You can post directly in the group, share ideas, talk to other listeners, and connect with like-minded folks. So go, run, join our Facebook group and tell us what you want.
Welcome, everyone. Here you are. You've landed on the Switch for Good podcast. I'm Dotsie, and this is Alexandra, and we're excited you're here.
Hi, Dot.
Hey, this is a little trickery for those that are watching on YouTube, because you are here in my house. So you are downstairs where I normally record, and I'm up in my office, and it's going to go great. We are going to have just a big podcast brainstorm sesh afterwards to figure out ways that we can just continue to improve, right? That's what we're always after, do a better job. So those of you that are a part of our Facebook group, we wouldn't mind you guys being brutally honest as often as possible on ideas and thoughts and ways that you could see us improving, bringing this information to a wider audience, and just anything personal that you think that we could really take a step forward on, or things that you just don't like. Tell us those too. Don't do this anymore.
A lot of the folks in the Facebook group have actually asked to hear about us and what we do. So It would be great if you shared things that you do in your life that give you balance, so that people who, and we're going to be talking with a guest who struggled with being really out of balance. So it's really apt for this show.
Yeah.
If you can share with us some things that help make your life so great.
Yeah, well, it's a work in progress, and I loved your sharing of I think you shared 5 habits that were just centered around general holistic health. So I'm going to do the same thing. So I am I'm very type A, and I definitely have OCD tendencies, or just full blown OCD. I'll just say it. So I have taken an approach with very extreme intention, because I've had to do it that way, to create some habits in my life, some holistic health habits that intentionally draw me away from being so obsessive and compulsive. And they help to balance. And I have kind of a rule in these 4 to 5 things I'm going to share that I don't have rules around them. So not easy for my type of personality. But let me share share first. Obviously, I think it's apparent that I like to exercise. As a former professional athlete, I guess I could have just turned like some of them do and then just not exercise at all anymore. But because of my years as a professional athlete, I got quite addicted to the dopamine response that I get when I exercise. So still in it, don't train anywhere close to what I did before. But I try to move every day. Usually I'll have it planned. And so maybe it's a mountain bike ride, or maybe it's a vigorous walk with my dog Chula. Maybe it's just weight training in the garage. Maybe it's a spin class, which is I go to a place where we dance on the bike. So yeah, I'm just going to say that my first time there, I was like, this is the stupidest thing I've ever, I am so snobby about it, but it's actually really, really fun. We don't sit down, we stand up the entire time. And there's quite a lot of upper body dancing on the bike. So whatever it might be, I kind of have a rule that I'm not rule-like about the exercise that I have planned out. This morning, as a perfect example, I was really tired, so I didn't get up when I thought I might get up. And I had planned to do a full hour of resistance training and weight training in the garage. I kind of have like a little gym set up in the garage. Well, things got underway and I had a 7:30 a.m. call, and that ended up going a full hour, and you were coming, which I was so excited about. And I needed to shower so I didn't sneak you out of the house. So it backed up into, it was only about 35 minutes that I had. And here's what I have really been trying to practice in, especially with exercise. Just move a little like that. I think we all have a tendency, if it's like, I missed that window, and then you just don't do it. And I just had 35 minutes. I ran Shula out of the door. We did a vigorous 20-minute walk. I came back in, I grabbed a couple hand weights, and I just moved. I just did. Some shoulders. I don't even know if it was effective, but I got that hormone release, and I feel better now because I know we're going to sit most of the day since we're going to brainstorm with our whiteboard. So it's just like, you don't have to have all these set rules. And if you don't meet the rule, then not do it is the point there. Still lean in, still just do a little bit. And that could really be with anything, right? Doesn't just have to be exercise. Another thing that I do that just has one rule around it is, at the end of the day, I almost always take Shula on a really big walk. We do 5, 6, 7 miles. She could do 30 miles a day if I could. So we head out, and I used to head out with my phone because, they're just always freaking connected to us. And I have a strap that goes around my chest, and the phone would be connected. Well, I found that I would check an email or do whatever you do with your silly phone. So I head out the door every night without my technology. I'm trying to just step back from it. And I've started getting excited when on Sunday afternoon, my iPhone tells me that my screen time was down. So that's my new goal. It has to say down, not up. And if it says up, I'm like, okay, you got to take some look at that, but just not so much of the phone in the life. And, I said to my husband a couple of days ago, it's like, do you have a watch? And he's like, I mean, I do, but I don't think there's any batteries. It's like, we don't have watches anymore, but I know you do. I'm going to go get a watch because sometimes I need to know the time because I want to get back to make dinner, or, it's just, so you don't need your phone for a timepiece. Get a watch, and you can divorce your phone and take a walk.
You know what I heard once about phones on, especially dog walks, was that this is a time for your dog. And you should be paying. This is what Rory Kennedy. No, she wrote Skinny Bitch. She also wrote Take Care of Your Dog.
I don't remember, but I know, right?
Like that.
Yeah.
And she said in the preface that your dog deserves this time. And so you should be completely attentive to what they want instead of embroiled in your phone.
Thank you.
So you're not tugging them when they want to sniff or something like that. So I thought that was really interesting and very thoughtful.
Very thoughtful, very true. And at the end of the day, it helps you, because when I am in tune with her and I'm watching and listening to what she's paying attention to, which is mostly squirrels and lizards, I decompress. It's interesting to me what she's interested in, and you just kind of bring it down to the simplicity of nature, right? Because that's where we're walking, and I think that is perfect that you added that in, because it's only fair to them, right? That they get to have that time. One other thing that I do is, when I do feel like I'm under a lot of stress and I feel like it's possible it'll keep me up. It's hard to keep me up because, as I've talked about many times on the show, I'm like a world champion sleeper. I sleep 9 hours. I wish I didn't. I'd love to be a 7-hour person, but I'm not. And we've had so many docs on the show that have talked about the critical nature of getting a really good night's sleep. And it's 8 hours. It's 8.5 hours. So many of them have said. So mine's usually 9, and it just is what it is. But when I do feel like, there's just a lot on my mind, it might keep me up, I'll use an app called Insight Timer, which is a meditation app. But I remove the rules from it because there's so many rules we can set around, like, okay, now I'm going to turn on this app and I'm going to turn on this meditation and it's going to last 12 minutes and I'm not allowed to fall asleep and I have to do the things they're saying and I have to breathe the way they're telling me to breathe. And at least that's my mind. Sorry, it's horrible to live inside of it, but I just remove all the rules. I pick a random, I just hit what turns on and I just hit something. I don't know if it's going to be 50 minutes or 10 minutes or whatever. And I just let it go and I start a breathing routine. And I always fall asleep and always wake up to where I just have to kind of like move the phone over to the bedside table. But I've loved that, has really been a beautiful way to end the day. I don't need it every night, but sometimes I do. And removing rules from your self-care, right? From your meditation, right? That's kind of the antithesis of meditation, is to have rules around it. And I recognize that. And so that is a wonderful way to fall asleep. And I will notice that it helps me to sleep deeper. Like I won't, if I don't do it and I have a lot on my mind, I'll think, oh, here I am 3 a.m, just staring at the wall. And I pass that energy on to Kurt and he passes it on to me, right? You're sleeping with someone. And the next thing I know, the next morning, were you up last night? Yeah. Around, and it's energetic. I'm up, and then that kind of, so I don't think that's fair to do to him or the dogs. The Chihuahuas that sleep with us are probably, I don't know, they snore really loud, so I think they're fine. But anyway, those are some of my holistic health habits that I try to remove my obsessive compulsiveness from.
Oh, Dotsie, thank you so much. I know that's going to help a lot of people. And the Insight app, because that sounds like a name of an app, that there might be many apps. Can you tell us what the app looks like?
Well, it's literally called Insight Timer.
Okay. Oh,
I don't think there's another Insight Timer in SIGHT. So Insight Timer. But it has like a brown meditation bowl.
Cool.
That's what it looks like. So yeah.
Great.
Yeah.
Thank you so much. So let's get on to our guest, who will also teach us also about not being as compulsive around her life too.
Awesome. Yes, another compulsive female is on the podcast. Oh gosh. All right, it's going to be awesome.
Dr. Monica Agarwal is a board-certified cardiologist and author and a super mom of 3. For years, she felt she had to do it all. She had 3 kids under the age of 4. She worked full time and got 3 to 4 hours of sleep a night. And this cycle continued until she was suddenly diagnosed with rheumatoid arthritis. Medication left her feeling off, but she slogged through a new normal until a meeting with a nutritionist changed her life. She read the studies, went plant-based, and years later, she's off all medication and her inflammatory markers are stable. Now she's spreading the word about diet and prevention to cardiology patients and med school students. Named Florida's Cardiovascular Researcher of the Year, she's a force that's changing the medical community for good. Welcome, Dr. Monica Agarwal.
Oh, thank you. That was so kind introduction, and it's a pleasure to be here, especially with such amazing people.
Well, we're so happy to have you. We've wanted to talk about inflammation for a long time. And one thing I didn't mention in the introduction is that you're also, your book is called Body on Fire: How Inflammation Triggers Chronic Illness and the Tools We Have to Fight It. And everybody go to YouTube so you can see Dotsie holding the book up now. It talks about your own struggle with rheumatoid arthritis and how you dealt with it. Can you share a little bit that story that preceded your diagnosis and what happened afterwards?
Sure. Always a little bit of a hard story to tell, so we'll see how I do with it. So, I think as a woman in medicine, we often struggle. I mean, and maybe 10 years ago, it's maybe different than it is now, but 10 or 12 years ago when I was in my training, we always felt that we had to continue to be as good as any man. There was, whenever you go into subspecialty, you're very rarely one of any other women in your group. For instance, in cardiology, 12% of cardiologists are women. So there's such a small number of us. So when you're in that situation and you know that people are looking at you as the woman in the group and, oh no, might she get pregnant? We always have these feelings, even though maybe it's not said outwardly, that you have to sort of be better than everyone else. or maybe it was just me. I don't know. I always felt this awareness that I had to sort of be the best in my fellowship, always sort of trying to always be better because I was around all these people that I felt like weren't expecting me to be there. So I spent a lot of time working, trying to always be better than everybody. I was always working, always running. Um, and then when you finish your training, you're in this situation where you're like, oh my gosh, now I want to have kids. And you're older and your clock is ticking and you're like, oh my God, I want to have all these kids. And how am I going to do that? Because I got to do this in a short amount of time before I become advanced maternal age, which happens awfully soon. And so I decided to have 3 kids, and I did it in a short amount of time. But it started with me having a few miscarriages. So at the end of my training, so as a cardiologist, you train after medical school. So from medical school until my training, I was in school for about 14 years. Um, and at the end of my training, I decided to have kids, but I continued to miscarry over and over again. And as any woman who's ever been through a miscarriage, something that is something. And so when my first kid came, boy, I was like it was heaven on earth. I was so happy. He could do nothing wrong. And arguably now that he's older, oh God, it's probably because I overdid it when he was little. But because of that, because I started late, then I had all those miscarriages. I decided I wanted to have a couple kids. I had 3 kids in 4 years. I mean, just every time I had no trouble getting pregnant, I had trouble keeping them. And my body kind of figured it out, I went with it. And by the time I had my third kid, I had 1 kid in diapers, 2 kids in diapers. One was a toddler who was 3.5 to 4, and one was 2, and then the newborn. And so at that point, I was working as a full-time cardiologist. I was raising 3 kids. I was trying to be perfect. I wanted to be this perfect mom. No one knows about that. Trying to be a perfect doctor, all the things that we're all trying to be like, I gotta be. So I used to puree baby food. I used to puree sweet potatoes at midnight. I used to nurse and I used to pump. I remember days where I'd be having a baby on the breast and I'd be answering a heart attack call. I would say, okay, baby. And my husband, I'd be feeding the baby and I'd be like, okay, okay, okay. And I'd try to take the baby off of the breast so that I could give him to my husband so I could fly to the hospital for a heart attack, and it was just this crazy life. But I felt like I'd chosen it because I'd chosen this is sort of the sacrifice I had to make. And I wanted all these things. Unfortunately, life has a way of reminding you that you can't do everything. And that's an important lesson, because I think in your 20s, you think you're perfect. You can do everything, or you can do as many things, and your body won't. It's okay. You'll make it up later. It doesn't matter. You can sleep less. You don't have to, it doesn't matter what you eat because your body's so resilient. But over time, what happens is that it catches up, doesn't it? It wears out over time. And that's exactly what happened to me. I was sleeping 4 hours a night. I was stressed all the time. I was trying to be this perfect mom. I was baking cupcakes and pureeing baby food and nursing these babies. God, if I ever see a pump again, I might go crazy. And in that time, I fell apart. I remember in particular, it was 4 months after I had baby number 3. And I started having this pain in my joints, and it was my finger. And I often find I massage it still to this day because I don't really know why. It's sort of this old habit. But it started with a joint in my finger, and I thought, oh, that's odd. I must have just hit it somewhere, and I ignored it. But then it went to another finger, and it went to my shoulders. It got to a point I couldn't lift up my arms. It went to a point where I couldn't do the snapping on baby clothes. And the worst thing I remember was the glass, the feeling when you stand on your feet, it feels like somebody's cutting your feet. So I changed my shoes 3 times. I kept buying new shoes because clearly the shoes are the problem and not me. And I remember imagining I was going to write these letters to these companies to say you should make baby clothes differently because snaps are just too hard. And who likes to snap clothes? Crazy stuff like that. Because of course, still in that mindset that I'm not the problem, everything else is. So many layers of problems in my thinking at the time. So after I remember there was a moment that it became pivotal for me when I really knew I had a problem. And it's a story I've told and I tell it, and it's sometimes hard to tell. So bear with me. But I was about 4 a.m. one day, and I remember that day always vividly because the alarm goes off at 4. I got to get down the stairs, switch off the alarm, let the dogs out, and I got to start the routine, which is that I have to make 3 lunches for the other 2 to go to daycare. I've got to make my own lunch. I have to nurse the baby, pump, so there's milk for the day. And then I got to feed the kids and shuffle them off to school. So in order to get all that done, you have to get up at 4, and I had to leave by 7:30. But I remember at around 4:15 or so, the baby cried. I was like, oh my God. And so I tried to run up the stairs because I didn't want her to wake up the other 2 kids. And I couldn't do it. I remember starting that run to go up those stairs, and I had to crawl up the stairs that day. And my husband will tell you that he remembers that day in particular because the baby kept crying and crying. So he'd gotten up to come over, and he found me at the bottom of the crib, just sitting there crying because I couldn't lift the baby out of the crib to get her out. And so he handed the baby to me, so I could feed her that day. And that's when I really knew that I was in really big trouble.
So interesting how the doctors don't go to the doctor. I've heard that before, and you're a perfect example. You were too busy to go to the doctor.
Oh, well, I was even worse. I diagnosed myself with Lyme disease. I decided I had Lyme disease because I had migratory joint pain. I was sure I must, and I lived in a kind of a wooded area. So I started treating myself for Lyme, and I just continued to worsen and worsen. And yeah, we're terrible. Physicians are terrible patients. And we, even though we think that it's because our knowledge is almost so much of the time makes us such terrible patients.
Mhm, mhm. Before we go into what it was, right, which is a large portion of what we want to talk about today, I'd love to just take a beat and just go back to your struggle and the expectations that are placed in general on women in the medical field. If it is, whether it's obvious or not obvious, so many women, female doctors that we've talked to feel this way. You felt that you first had to wait to really have a family, but then you felt like you had to do it all, work and be a full-time mom. And you mentioned you felt like you had to be better than everyone. I'm sure you've dug into this, maybe just in your own mind or in therapy, but where does that stem from, do you think? Why do we feel like we have to be so much better? And why do we feel like because we want to have kids, that's almost in the workspace anyway, whether it's the medical field or any field, kind of like not so great, men aren't going to have to do that. So we've got to be better than they are because we're going to do this kid thing, and we're going to have to like maybe focus on that in some portion that could potentially take away from our work.
Such a deep and important question, and one that I definitely have considered, and I don't know if I fully know the answer. I mean, I would say that it's years of us being almost taught that this is, from some television, from social behaviors, from our own parents, the expectations. My mother, for instance, in a traditional Indian household, she cooked every single day after work. My father did not. She did all of the dishes at the end of the day, then made a cup of tea, cleaned the house. Everything was done by her, but she had a full-time job too.
Wow.
It stems from all of those. And then the people around us, all the role models we have around us tend to do the same thing. And they'll say, well, these are the things we have to do because we have to run the household, as if it's only our job as women to run the household. And then, think about television, even like now it's a little bit more progressive, but even 20 years ago, we weren't seeing that kind of stuff. And And then think about in medicine in particular, now their medical schools are 50-50 male, female, but 20 years ago or 15 years ago, it wasn't that way.
Mhm.
Fellows, they're in terms of subspecialty surgeons and subspecialty medical doctors like myself, so few of us are women. And you hear the jokes, you grow up with the jokes and people say, oh, we don't really say that. We don't really mean it. But the jokes are always there. I remember a fellow colleague of mine, cardiologist, saying, he asked me one time why I didn't have lunch with them, with all the rest of the guys. And I said, well, I don't have lunch with the rest of the guys because I have to write all my notes then so I can run home and feed my kids because I don't have a wife. And he said, to me, and he started laughing at me and he's like, well, I didn't tell you to go into cardiology, you should have picked something else. And he's saying this as a joke, ha ha ha. But
Mhm.
again, these are the things that we hear. I remember as a fellow, it was never said that I couldn't have a child as a fellow. Where fellow is a training in your specialty. So after residency, you do another 3 years of sort of my specialty, which was
Mhm.
cardiology. No one would say to me that I couldn't have a child, but
Right.
well, everybody will have to cover you. And remember, there's only 4 people. Usually, there's 4 to 6 or some trainees, and so most of them are men. Then they're, well, we have to cover you. Well, we have to find coverage for you. And it's these underlying tones that we hear. It's this, and so we continue to put expectations because we don't want people to cover for us, as if having children, as you pointed out, is something that we should be embarrassed about. And so, but that's what I remember feeling like. I would be like, oh my God, I can't get pregnant until, as if we have that much control over our clocks. I mean, it's this
Yeah.
absurd thing we do to ourselves.
How do we change this archetype? I mean, I'm sure you're thinking about it and actively as younger women come through that are new, brand new doctors, and they're struggling with possibly exactly the feelings and the thoughts and the guilt that you were feeling. How can we change this?
It's so interesting because I, for a while, I chose not to mentor women. And I chose not to mentor women for, this is, 5, 7 years ago, because I felt that I wouldn't be a positive role model for other women, because I wasn't sure that I would recommend to women to go into subspecialty medicine,
Mhm.
because it was so difficult for me. I got sick from it. I didn't feel supported in my environment. And then I had to really sort of examine that, and I had to really look in and say, what's going on here? Like, that's not right. And I need to be a positive role model for other people, despite not having had those role models for myself. And so over the last 5 or 6 years, I've really made an effort to work with females.
Isn't it a lot about men having to be educated and change because they're not, women are now doing double duty and men are not picking up the slack, whether it be at home or at work, to accommodate the double duty? Isn't it men that need to change the system? They're the ones who are creating, it's keeping the status quo. They're thinking that they can keep the system the same and just add women into it without giving any kind
Yeah.
of understanding of the fact that
In cycling,
mean,
it's they're in the
change.
draft all the time, right? The men are always in the draft, right? It's like come out into the headwind and do the work so that it's more balanced. Sorry.
Bravo. I love that. I love that. I want to, I think it's a societal problem. I don't want to even say that it's men or women, because there's so many men out there that say, well, gosh, I really support my wife
Yeah.
or and my sister. And I do think that most men are naturally good. I do think, though, that they are also a product of the same view, which is that their moms were doing all of the work, and so they don't understand. Like my little brother, is a great guy, he doesn't cook. And it's like, well, how come you don't cook? Your wife works, you work. He's like, well, I work more. Really?
Oh,
Oh,
Like,
interesting. And you know what? You're right, because if women, it is about women too, of course. If his wife stopped cooking, hey, guess what? He would learn to cook. But we women, we feel guilty if we do that. If we would stop doing the housework or the certain parts of raising the children, we would feel bad.
I think the guilt is the single most biggest problem as a woman that I personally can say is my biggest fault. Because as a woman, I feel guilty if the kids wake up and I'm not right there. I feel guilty if I haven't fed them or they say, Mama, you were late. I even disclosed to you that before we started. My daughter would tell me that I was late to school, or and there's this constant state of guilt because we feel we were, maybe because our mothers did it and because my mom did it, shouldn't I be able to do it too? Or something is happening in our heads that we feel this guilt from such a young age. And I think that I'm proud of the women of today. I think that they're definitely stronger than I was. They definitely know what they want more. They're willing to say no, and they're willing to fight. They're willing more to fight for it. The system in medicine is still very male heavy, but there are always articles going around. In fact, article even I wrote, I'll send to you, which you might find interesting, which is just sort of saying, that we are trying to do better. We need to do better. But even today, the number of women that are in the senior positions in medicine, very, very low, less than 10%. You're not going to see deans that are women. You're not seeing chiefs as women or chairs of medicine. And so they're more of the anomaly than the regularity. And so, yeah, it's a problem that I could spend hours chatting with you about, because it's such a fascinating topic and one that we as women. And then the other thing I would say is, and I know we're sort of, I don't know if this is what we should be talking about totally through this, but another thing that I often think about is how there's so many women that don't support women. And I got there. Well, they should be able to get there. And perhaps maybe I was going through a little, I don't think that was my issue when I wasn't mentoring. I was more of in a negative place, but I really make an effort to help women, because I feel like if we don't help our own, then, where are we? What's the future to be like? And I think we really need to support other women. And so men will say, well, shouldn't you support women and men equally? Well, yes and no, because men have had support for decades, centuries, and it's okay to support women, because women for so many years have not been nurtured, loved, and supported the way they need to be.
Yes. Okay. So now we're going to move on,
Well
because I
said.
know that our audience, you have to go pick up your daughter. So we have a limited amount of time with you. And also, I know people really want to hear about how you dealt with this illness that befell you at that time.
And how did you even figure out you had it? Because we left off with you crying, sitting on the floor next to your son's bed, and to get there, you weren't able to really walk up the stairs. You had to kind of scoot or crawl.
So at that point, you're in a really dark place, and I decided to call an internal medicine friend of mine, an internist, and I said, look, I'm in a situation, my joints are really hurting. I've treated myself for Lyme disease and I'm not getting better. So she ordered some blood work for me. And the labs were through the roof. My inflammatory markers were very high. My rheumatoid factor was greater than 50. So 50 or less is what you want. Greater than 50 is not what you want. And their anti-CCP antibody, which is very specific for rheumatoid arthritis and arguably for a more destructive course, is usually something under 250, and then it doesn't calculate over 250. And mine was greater than 250. So I was told, so I decided besides freaking out, I had 3 small kids. I knew what it meant. I thought, the images in medical school of a life of disability were coming to my head. So I went to see the senior rheumatologist in the town that I was living in. And I walked in the door, and I was 5 months now postpartum, feeling very small, massive but small, massive ear, massive breast, but feeling just so small. I remember my husband couldn't even go with me because he's on the phone, because we had the kids, and he's managing the kids so that I could go to the appointment. And I remember him being super flippant and saying, okay, you have rheumatoid arthritis, and this is pretty advanced in terms of your numbers are very inflamed. You have a destructive course ahead of you, and so you need to get on medication. And I was like, okay, well, are there any other options? There's anything I can do? No, you have to get on medication. You should get on medication within the week. Just like that, within the week. I'm nursing a baby. He said, well, you just need to wean the baby off and get started on the medicines by the weekend. Um, and that was the end of it. And I said, well, are there, again, options? No. I remember even at one point, probably later in the course of my care, he said to me about it that, will I ever come off of these medications? He said, no, you'll never come off medications. One thing you have to accept is that there is no cure for this illness and you will never come off of medications. So that's just something you have to learn to accept. And then you're
Did
shuffled
they
out.
say how you got it? Like that's the key part. It's like, okay,
Yeah.
but how did this happen? How, and so many doctors, I feel like because of the system today, right? And it's just boom, boom, boom. You've got 5 minutes with the patient that comes in. You can't get to the root cause. You can't get to the systemic issue. And it's just like, this is what you have, take this drug. But how did I get here? Because then maybe we could unravel to how to heal.
So you speak to primordial prevention, which is what we all need to focus on. But at the time, no. I remember asking him, and he said that we see this commonly in women postpartum. So and why? Well, because the hormonal shifts was the thought. Which is true. Hormonal shifts make sense. It's not that it doesn't, but nobody had even used the word. I'm not sure that he ever said the word inflammation at the time. He may have, but I don't recall it. And so, yes, you're put on steroids, so that does suppress the inflammation. So it's not that there's no understanding of inflammation. I mean, these doctors are smart people. It's just that fixing the inflammation in other ways is not really considered. So you're put on steroids to deal with the acute symptoms. I even asked, can I just take ibuprofen? That's an anti-inflammatory, but that at the time, and that's changed now since, thank goodness, these disease-modifying anti-rheumatic drugs, also known as DMARDs, were standard of care, and arguably are still standard of care. But I was put on methotrexate as soon as I stopped nursing. So that was probably the hardest thing I've ever done. I mean, there are many hard things at this time, so maybe not the hardest thing I've ever done, but walking away from a baby crying with milk leaking out of your breasts and thinking that you cannot feed that child is something else. And she's just screamed for me. So it was definitely hard. And but I did it. I did what I had to do. I thought, or at least what I thought I had to do. And I took the methotrexate, I took the steroids. My hair fell out. I had a metallic taste in my mouth all of the time. People would remark how great I looked because I just had a baby and I had my third child and I'd lost all my baby weight. How lucky. And it was really that I felt nauseated and terrible all of the time. So I didn't want to eat. So, this is how we do. We play these games, the figure, there's all these emotions, right? You're trying to be this perfect person. Your body is failing you. You're worried about your life. You're worried about your children and if they're going to grow up with this disabled mother. You're worried about sort of how you're going to look and how you're going to look to your colleagues and how you're going to, and then the medicines are unraveling you inside. I mean, I had a lot of sadness and grief, and I also had a lot of anger. That's something I am embarrassed to say, but I did. I had a lot of anger, and I was angry at my kid. And it was like I was angry because I can't believe I used to say to my husband, why did we tempt fate and have that third child? If I hadn't had a third child, maybe this wouldn't have happened. And I started feeling this bitterness about having done that. The irony in what I've told my daughter, who's now able to read this chapter of the book, in that story, she read it and she said, Mama, I made you sick. And she came to me crying one day and she goes, Mama, I made you sick. And I've told her, and as I tell you today, if I hadn't gotten sick, then I would never have learned how to get better. I would never have learned how to heal other people. It changed everything for me. It changed my entire life getting sick. And while I never wish illness on anyone, it's only because of her, because of my illness that she saved me. I mean, she truly saved me. And I tell her that. I said, baby, you did not make me sick. You saved my life. And and that's how I feel. I mean, I really do. And that's why that book is to honor her, because if I hadn't gone through that experience and I hadn't felt all those feelings, I wouldn't be who I am today. I wouldn't be the doctor I am today. I wouldn't be the mother I am today. I'm just a different person.
So you went from, you followed the doctor's orders because you had no other course and you needed to get back on it right away because you had so much responsibility in your life. Then you met somebody who changed the course of your treatment and also changed the way you are as a doctor. Can you share with us what happened and how it affected your rheumatoid arthritis? I'd also really like you to give an explanation of rheumatoid arthritis,
Sure.
because I don't quite understand exactly what it is. And I'm sure a lot of our listeners don't either.
Sure. So maybe we'll start there. So
Okay.
rheumatoid arthritis is an autoimmune condition. So it's where your body attacks you. And so there are many autoimmune conditions, one of which is Crohn's disease or other inflammatory bowel disease, type 1 diabetes. These are all autoimmune conditions. And you could argue that many illnesses in general are autoimmune in some ways. But so what happens is that in your body, you have some level of genetic predisposition. I was genetically predisposed to rheumatoid arthritis. I don't know why, but I was. You can't change your genes. You can't change your family, at least not yet. So I have these genes that I had. So something triggers that gene to then express. So some people call that a second hit, but something triggers your gene to express. From, the doctors at the time probably would have said, well, the hormonal changes of pregnancy or what triggered you to have the illness. Well, the other way to look at it is that it was just always about inflammation, right? My body was totally inflamed, and inflammation, and we're learning more and more about how much that is a trigger for illness and arguably a trigger for every illness. And so my genetic predisposition was for rheumatoid arthritis. And then I had this inflammation, which then activated my genetic predisposition, which triggered my illness. So if you calm the inflammation, then you potentially solve your problem. You maybe don't cause that gene to trigger or express, and then and if you have already expressed it, you can suppress that inflammation and maybe suppress your illness. And so in rheumatoid arthritis, when you have that inflammation, it attacks your joints. So the inflammation, you often find it in your joints, usually here and here. You find it in the same and in your feet. Often people will get bone destruction and the fingers will start curving. You can get it in your spine. People will feel it in all of their joints. They feel extreme fatigue. There are many other sequelae that go with it, but primarily rheumatoid arthritis is considered a disease of the joints. This is not like osteoarthritis, which is a disease of the elderly, which is when people, as they get older and maybe carrying a lot of weight or a lot of mechanical injury, will get, when they lift, their knees hurt or their hips hurt. As they get older, that's more of an arthritis. And we see that in runners and athletes as well, because it is endurance and mechanical injury. But rheumatoid arthritis is pure inflammatory, and then again, like I said, triggers in those small joints in the hands and the feet. Your second question was about Karen. So I remember one day, so I started getting better with the medication, and so I felt like, okay, I can do this. I can, even though the side effects were there, I can handle this. And so I used to run these prevention wellness meetings, and they were these just things people in the community would come to them, and we would do blood pressure checks and cholesterols, and we would teach people how to exercise. So I already was, focused on that, but there was never a nutrition component, by the way. And so this woman came to my office and she said, look, I'd like to do I'd like to do nutrition counseling for your patients. And I was like, it's kind of full. I was probably not so nice to her. It's kind of full. We're good. And she goes, okay, well, let me tell you what I do. Let me do your nutrition profile. And so I was like, oh yeah, no, I got this. I'm healthy. Like, how ironic. I was like, I'm healthy. Like, what? So I was already vegetarian, but I was a junk food vegetarian at the time. I thought that I knew everything about nutrition because doctors can be cocky and jerky. Another fundamental medical. I can talk all in all about doctors and our problems. So she said, "Well, let me just do your profile. Humor me." And so I did. I let her do it, and she started me off by writing She wanted me to write my diet down and daily diet, and I wrote it all down and I gave it to her, and she came to my house and met me, and we sat down for several hours, and she said, have you ever thought about cutting out dairy? And I was like, what? Milk does your body good. Pass it on. What are you talking about? And we started talking about inflammation a little bit and about dairy and IGF-1 and hormonal changes. And it just blew me away. And it's for the first time, it made me start thinking about how how nutrition can impact you. And it started making me think about everything, actually, about everything in your lifestyle. And she started me off on this whole path where I started thinking about sleep, how much I was sleeping, and stress response, and parasympathetic and sympathetic tone. Then I started going off to classes at Harvard and all over the country trying to learn about nutrition. And then I started learning about the gut biome and how the gut flora is really everything, and how the gut flora triggers inflammation when the gut is sick. And so, making those links, it started blowing me away. So I changed everything. People say, well, did you do it gradually or quickly? If you haven't figured anything out about me, I'm all full on. So I did everything. I started sleeping. I stopped running, which was one of the best things that I'm a big runner. I love to run. I stopped running. And sometimes I remind people that, exercise is so important, but sometimes overdoing it can be inflammatory. And I was in an inflammatory state, and I didn't need to be doing more and more things to trigger my body. So I stopped running and I started doing yoga, and I changed my entire diet. I changed everything because I was eating vegetarian, but I was eating all the junk food. And I changed everything.
Wow.
I think when we talk inflammation, there's a strong case for us needing to kind of demystify it, because inflammation is also can be good. And I just know that from being an athlete, when you get injured,
Yes.
and something swells and your body is rushing recovery nutrients to that injured ankle or knee to heal it as fast as possible. So what actually is the definition of inflammation, and how is it used naturally by the body for good? And then how do we, mostly by lifestyle, from what I'm understanding, make it bad in the body?
Yeah, I'm so glad you brought that up. So, and very important point, inflammation is absolutely good in short amounts, and it's like the stress response too. So maybe describe, the reason we named the title of the book Body on Fire, because that's what I just think of as inflammation. Your body is mad at you. When your body is mad at you, and for short amounts of time, being mad at you is a good thing. As you pointed out, when you're in an injury situation, for instance, let's imagine you're being chased by a robber. You're running and you're getting scratched on the way, and your sympathetic tone is high. You're in this fight or flight response, and you're running. You're not thinking about urinating. You're not thinking about how you hurt yourself and you scratch yourself. That's that fight or flight response. And then your body is supposed to recover. The robber gets blown up, whatever happens to the robber, and then you are recovering. So that is very normal. So that's a sympathetic response. Your heart rate goes up, blood pressure goes up, and you run. And then then you recover. So that's sympathetic and parasympathetic. sympathetic. Most of us are always like this and sympathetic, and down here in parasympathetic. And that's imbalance is what often triggers us to be always on and so much of the time. So a short amount of time of sympathetic tone and is good because it helps you save yourself from that tiger. Another illness description is how you described it when there's an injuring or if you have a cut. Well, you need to have inflammation and illness because that's what brings over the white blood cells, and those white cells treat the infection, and all those things trigger inflammation and swelling, and all that stuff is good because it attacks that instant cut. But the problem is when that cut is always there or it's always open, then you're having constant state of inflammation, constant state of swelling. That's not the good thing. So similarly, imagine that inside your body. That's an external example. If you have a short amount of inflammation, that's a good thing. You want to be able to respond to, if you eat something and it goes into your gut and you trigger an inflammatory response because your body doesn't like it, then your body has learned from that behavior. It's developed an immune reaction and it's responded, and you have an appropriate response and you're ready for next time. You've got memory cells, and so next time that happens, you're ready to go. The problem is that when you have that constant attack, constantly traumatized by something or a constant insult to the body, then you're going to have constant level of immune reaction, which causes more inflammation. So a perfect example of this is celiac disease. And so a lot of people, this is sometimes easier for people to get because a lot of people know what celiac disease is, which is an allergy to gluten. So I like this example in particular because it's a perfect food example. So people who have celiac disease have an allergy to gluten. So if you eat a piece of wheat and you have you eat that wheat, it goes into your gut, and then your intestine actually has these things called tight junctions and they break. And then the insult gets into the bloodstream and your body says, okay, no problem, I got this. And it brings all the white cells and the immune reaction, and you create a short-term reaction, and your body maybe has a upset stomach, maybe a little diarrhea, and we're done.
You said the insult gets into the bloodstream. Can you define insult? What would be those components?
So that insult could be like a virus or a toxin. Any of those things could be considered the insult. Any toxin, so it could be a virus, a fungus, a bacteria, or a toxin. So in this case, it's the gluten for the celiac patient. So if a celiac patient doesn't know that they have an allergy to gluten, they continue to eat gluten over and over again. So when that happens is they keep eating it, it goes in those junctions, which are just broken for a short time with one insult. If you keep having it, they're broken for hours. So all those toxins then are getting into your body, and you're having this constant immune response, inflammation. So you could say, well, gosh, inflammation's not, you just said inflammation's not a big deal, but when there's so much inflammation, it starts spreading to other parts of the body. And depending on what genetic insult or your genetic story, you will then it'll start attacking that area. For me, that genetics is rheumatoid arthritis. So in times of stress or times where I'm getting too much inflammation, my joints will activate. I had a perfect example of this about 3 months ago or 2 months ago. I haven't had any joint inflammation in 10 years. Since my diagnosis, I've been on no medications for 9 or 8 years now. And I always say I'm not looking back. I'm so proud of that. My biggest achievement. But then what happened was 2 months ago, I moved. I had to move 3 children. I was, again, not sleeping well. I was eating okay, but all the other things had fallen apart. And so my joints started swelling again. And I haven't had that in years. And I cried. I cried and I said, oh my God, it's back. But I had to learn and I had to stop myself. And somebody actually told me, one of my friends said to me, she said, you haven't had inflammation in 10 years. Figure out what your inflammation is and rise above it. And so that's what I did. I needed to hear that. And I had to really look and say, okay, what have I done differently? And again, I had to go back to, I wasn't sleeping, my stress levels were high, and everything that I had done 10 years ago was back. And I again did the same changes and I healed. And so I guess the story, I guess we were talking about inflammation. I got distracted again, but I guess I'd like people to know that because we're always at risk for our triggers in our life to get to us. And again, it happened to me and I thought, oh God, but we always can get it back. And you just have to focus on healing your body, but it can't just be one thing. You have to work on your nutrition, you have to work on your sleep, and you have to work on, yes, it's hard, but everything good is hard.
Yeah. Yes. It's true.
You know that better than everyone.
True statement.
You mentioned food and that you changed your diet and that before you've been a junk food vegetarian. Can you talk to us a little bit about, are there some foods that are inflammatory and some foods that are blanketly anti-inflammatory, or does it depend on the person? Because I remember in the 80s, early 90s, there was this messaging going around that if you ate too much of one thing, your body would become allergic to it. So it was good to have a lot of variety. I don't know if you'd ever heard that. So that made me wonder, are there just some foods that are just blanketly really anti-inflammatory for everyone and some that aren't?
I don't think that there is a one food prescription for everyone. I don't think that everybody has to eliminate everything in order, some people will say you have to eliminate all these foods. I don't feel that way. I do think there are certain foods that are typically more pro-inflammatory, but there are certain things that will be triggers for some people and won't be triggers for others. So some of the broad pictures of pro-inflammatory in general, I think dairy is one of the most pro-inflammatory foods. I'm pretty anti-dairy, anti-cow's milk, I should say. And I know that I'm in good company here. So I do feel that dairy is very pro-inflammatory. In all of my patients, actually, with heart disease and with autoimmune disease, I eliminate dairy. And so I do think that most animal products tend to be inflammatory, in particular cheeses and red meat in particular. Is there room for some level of flexibility? So I don't know the answer to that. I tell people that I never want to get sick again. And so I will never try to eat animal products again, ever. And so maybe there is some flexibility in certain illnesses. For instance, some people say, well, can I have fish with heart disease? Maybe. But when it comes to me and how I feel about my illness, I will never eat animal products again. And so I do think that they're very inflammatory. In terms of nightshades, some people will talk about nightshades being inflammatory. I haven't had that experience. Some people have problems with gluten. Yes, so that or certain people will have triggers. And so often when I work with patients on their diet, I often do some large changes and then I stop there. And then I'll say let's start with things like, let's cut out your dairy and let's cut out your red meat. And often I'll start there. For somebody who maybe can't make big changes all at once, I'll start there. And then I have them watch for 6 weeks. And then I start slowly seeing, are we getting where we need to be? How's the stool? How are the inflammatory markers? How are the joints or whatever their illness is? And then I'll slowly start removing more and more. On the other hand, there are other people that are more like me who like to do the more drastic changes. And for those people, I'll often cut things out and then I'll add back. But it just depends on who you are. For instance, once I heal, I can never add back because I'd be too scared that I would get sick again.
Yeah.
You mentioned your cardiology patients, and you are a cardiologist. And if I didn't know this, but I did doing my research on you, I learned that cardiovascular disease is number one reason for Americans dying twice as many deaths as cancer, which is the number two killer. And so can you talk to us about cardiovascular? What is it? Because I realize when people say cardiovascular, I'm not exactly sure. And can you link it to inflammation?
Sure.
Why inflammation is so important?
Oh, yay, my favorite topic. So yes, now heart disease is the number one killer of men and women in the United States and in the world. When we say the word heart disease, we often mean vascular disease, which is really disease of the blood vessels. But some people, when they say heart disease, mean sort of the valve disease. So it's this massive umbrella term for anything related to the heart or vessels of the body. But technically, so when we're talking about heart disease and we're talking about what most people think about, they're thinking about what causes a heart attack. So what I describe is I often like people to think of the heart. So the heart's this pump, sits on the left side of your chest, and you have these blood vessels that come off of it, and those blood vessels are called coronary arteries. And when you're born, those blood vessels are smooth, and as you exercise, they expand to accommodate more blood flow to the heart, so the heart can then pump to the rest of the body, so that as you exercise, your muscles get more blood and you can exercise and don't feel uncomfortable, or that you're able to perform what you need to perform. So you need to have adequate blood flow through those coronary arteries that are on the heart, so the heart can pump blood to the body. So when your blood vessels, or when you're born, your blood vessels are very soft and smooth and beautifully pink. And like I said, they expand and contract based on how much blood is needed. What happens over time is that if you develop poor lifestyle habits like high blood pressure, diabetes, high cholesterol, some of which, yes, is genetic, but so much of it is lifestyle based, then what happens is those blood vessels get little cracks in them. They get little fissures in them, if you want to think of it that way. And your body says, okay, no problem, I got this. It triggers an inflammatory response where it sends over the platelets, which is their job is to actually fix that fissure. So then when you have that little fissure in your blood vessel, it heals it. So you get a little scab on top of that little fissure. And then as the cholesterol passes by, it attaches to that little fissure and that scab. And so what happens is over time, it builds up and builds up. But if you have a scab outside of your body, it doesn't matter if it's this big or this big, but when you're inside a blood vessel, then as you start building up plaque, that becomes bigger and bigger. So what happens then is that your body, when you exercise, your blood vessel can't expand and contract as easily, because what we get is endothelial dysfunction, which basically is the blood vessels on this inside area of the heart, or of the blood vessel, can't expand and contract like they should. So then when you exercise, your body's like, okay, I need more blood flow. Your muscles say, I need more blood. So the heart's like, okay, I gotta do that. I gotta do that. Send me more blood. Coronary arteries, which are sitting on top. And so the blood vessels are like, and so they can't open and expand as much. And then the blood that's there has to get around that plaque. And so then when it gets it, less blood is going through. You can imagine that less blood is going through. And so over time, what happens is your heart's like, I can't do it. I can't do it. I can't get the blood where it needs to get. And you often will develop something called angina. So, and then angina is sort of a response to ischemia or decreased blood flow to the heart. But that's not the worst part, because what happens is that these plaques in your heart, which build up your whole life, some of those which are just sitting there in the blood vessel, then sometimes some inflammation will irritate this plaque and it will rupture. And it clogs the whole vessel acutely. So it's sitting here like this, where it may not have caused you much trouble at all, but something irritates it, a chronic inflammatory response, and irritates this little plaque. It ruptures inside the blood vessel and closes off the vessel. That causes an acute heart attack. That's the heart attack where you come to the hospital complaining of chest pain, and we take you to the heart lab immediately. We open you up with a balloon and stent. That's an acute heart attack. That's what Carrie Fisher died of. That's what James Gandolfini died of. Those are those plaques that are small and they just rupture and close off. Your body never had a chance to deal with it. They didn't even know it was coming. It just had inflammation, and then boom. And then the blood vessel, that's heart disease. And that's what we're talking about. And those are all triggered by, yes, genetics, but genetics plus lifestyle. Lifestyle is absolutely so important. We have studies in our literature that show that despite your genetic risk, because people say, my mom died at 45, I've just accepted it. Well, what do you mean you've accepted it? That doesn't make any sense, because we can change our lifestyle and change that result. So there's a study that shows that if you have high genetic risk and you have a poor lifestyle, your risk of building plaque, say, is here. But if you have that same high genetic risk and you have a great lifestyle, you can reduce that risk by 50%. So similarly, if you look at somebody with low genetic risk, then that person has a good lifestyle. They will have maybe a risk of heart disease of this. But if they have a low genetic risk and a poor lifestyle, they will double their risk by 50%. So why are we not working on lifestyle? Such a big and important problem. The reality is that our hospital, our medical system is so flawed because we focus on value-based, we focus on acuity-based care and not value-based care. And that's fundamentally the problem. My prevention clinic, I spend 1 hour long with each of my patients. That's not nearly as lucrative as if I saw those I saw 4 patients in that hour and sent 2 or 3 of them for stenting procedures, which then gives the hospital more money. Nobody likes to talk about that, and I'm not going to be looked at well because I say that, but it's true, because if we then send those patients for procedures, everybody makes more money. But what about the fact that I spent that 1 hour with a patient and I cured their illness, or I helped heal them? I took them off of medications. I made them overall better. And the studies show that if you compare head to head stents versus medication, and stents versus medication plus lifestyle, there is no question in study after study after study that stents do not make you live longer. Medicines and lifestyle do. I cannot emphasize that point enough. And it's something that often people forget and ignore because they see the vessel, they see the little bit of plaque or the clog, and people want to stent it. Like, wait a second. That is not going to make this patient live a whole longer life unless they're having chest pain or angina or something different. But if they're having no symptoms or minimal symptoms, 9 out of 10 times, I can treat those patients with a good medication and lifestyle plan.
Is that because the stent, it'll come up somewhere else in the blood vessel? Maybe not where the stent is, but there'll be an issue somewhere else, an inch or 2 above or below?
Well, so, the reason is that ultimately mortality is not based on one single area, like you point out. It's related to, most people, for instance, when we did autopsies on 6-year-olds who die of leukemia, they already have fatty streaks in their heart. If you look at 18 and 20-year-olds who died in Vietnam and in Korea, they already have plaque. So it's like they have these small little plaques in their heart, and we probably all have a little bit of plaques in our heart. Maybe some of us will have that, especially after we hit our 50s and 60s, and they're 10 to 20% lesions. The problem is first of all, the acute heart attack doesn't happen from the 60-70% lesion. It happens from those small ones. And so you can't stent all of them, or everybody would have metal all over their whole heart. And so those stents just deal with an acute situation and an acute symptom. They will not make you live longer. And that really needs to be emphasized. The only thing that's going to make people live longer is good lifestyle. Eat well, eat clean, exercise, sleep, reduce stress. These are the things that we all need to focus on. Why we don't continues to be a mystery to us all, and one that we all continue to fight. The reason all 3 of us are here today, the reason we have these moments, is because we're trying to change the world.
Yeah. We know you have to go be super mom. I feel like, if it's okay with you, Dr. Monica, that we do a part 2, because just to tease for people, we also want to go over how to learn that we don't have to be a slave to our genes, that we have control on how they manifest themselves, and the role our central nervous system plays in that. We didn't get to go into milk and autoimmune disease. You guys really did a beautiful job in the book of connecting that. And also, I love the section on the difference between low calorie and high calorie density that I think people would. So you guys are teased now, audience, for Monica part 2, which we would love to book you for, because there's just so much more. And in the meantime, you guys go get the book Body on Fire.
Oh, it's my pleasure. Thank you so much for having me here today. One thing I'll just leave everyone with is one thought, which is that change is hard. There is no question. But every day you can make a little bit of change and it doesn't feel so hard. And so, but it has to happen, right? Because if we don't make the changes, then we're left with a life of heartache, literally, figuratively, and, an illness. And I'm a perfect example of what happens when you don't take care of your body. But I like to believe I'm also a perfect example of what you can do when you do take care of your body.
Mm-hmm.
Great. Thank you so much. And thank
Well
you
said.
for spreading the word. And we look forward to talking to you more because we have so many more questions.
Yeah, my pleasure.
Hey, folks. Okay, back by very popular demand is our plant-powered plate fridge magnet, which you are going to receive for free if you leave us a rating and a review on whatever platform you're listening to this podcast on. So here are the details. Just write your quick review. Does not need to be long, does not need to be a whole story. Just be honest and speak from the heart. Then take a quick screenshot of the review you wrote and email it to us at podcast@switchforgood.org. That's podcast@switchforgood.org. And include your mailing address so we can send you a power plate. We are doing this because the more reviews we garner, the higher we go in search results, which means more folks will learn about our podcast. So the power is in your hands. Leave us a review and zoom, zoom, your power plate arrives at your doorstep.
So thank you so much for tuning in today. If we helped you in any way, then click the subscribe button and let's keep hanging out together. We have so much more to share with you.
And if you need more information on actually making the switch for good, please visit us at switchforgood.org for loads of info. And you can subscribe to our mailing list where you will receive all sorts of super cool gifts, discount codes to our very fave dairy-free products, and a lifetime of powerful health tips.
So join us on the journey to switch for good. This is the future.